Hi guys, welcome back for our daily practice questions. It is day 59, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 55-year-old female presents with symptoms of fatigue, weight gain, dry skin, and cold intolerance. Lab results show an elevated TSH level and a low free T4. Which of the following is the most likely diagnosis? Is it A, hyperthyroidism, B, hypothyroidism, C, subclinical hyperthyroidism, or D, thyroid storm? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, which of the following is the most likely diagnosis? And y'all know what I always tell y'all. If they're asking for a diagnosis, you need to run it back and look at the assessment findings. Pay attention to three common details with those assessment findings as well, because it can help to aid in differential diagnoses as well as treatment, right? So those three things I always tell you is the age, the gender, and the ethnicity. So here we have a 55-year-old female. She comes in with symptoms of fatigue, weight gain, dry skin, and cold intolerance. All right, so you should start to have your mind gearing to um, certain thyroidism, right? So hypo because things are slower, right? So they're feeling tired. They're having the weight gain because they are sitting. They're less mobile. The cold intolerance. But here the lab values should help you to confirm your differential diagnoses, right? So the TSH level is elevated, whereas the free T4 is low. Remember, with thyroidism, the TSH goes the opposite direction of what the terminology means. So hypo means low, TSH is elevated. So your best answer is B, hypothyroidism. Question number two, a 40-year-old male presents with palpitations, weight loss, heat intolerance, and anxiety. Lab results show a low TSH level and elevated free T4. Which condition is most likely to be causing his symptoms? Is it A, hyperthyroidism, B, hypothyroidism, C, subclinical hypothyroidism, or D, Hashimoto's thyroiditis? Take a moment to tell me what you got, y'all. So the stem of the question here states, which condition is most likely to be causing his symptoms? All right, so again, it's asking for a diagnosis, right? So we have a 40-year-old male comes in with palpitations, weight loss, heat intolerance, and anxiety. As I always say, when you think about thyroidism, I want you to think of hyperthyroidism as someone that is hyper. So they're running, running, running. So their heart is racing. They're having the palpitations. They may have weight loss from doing the excess exercise. May feel anxious because of the heart racing, but also the lab results here are showing and confirming that because the TSH level is low. Remember, the TSH level will present opposite of what the terminology means. So hyper means elevated, right? Means high, whereas this TSH level is low. So your best answer is A, hyperthyroidism. All right, and lastly, question number three. A 65-year-old patient with a history of autoimmune disease presents with fatigue, constipation, and cold intolerance. The lab findings reveal an elevated TSH and a low free T4. What is the most likely diagnosis? Is it A, hyperthyroidism, B, subclinical hyperthyroidism, C, hypothyroidism due to Hashimoto's thyroiditis, or D, thyroid carcinoma? Take a moment and tell me what you got in the comments. All right, so the stem here says, what is the most likely diagnosis? So same thing we've been doing throughout the last few, but something I want you to pay attention to in this question. So same thing here. This patient comes in with fatigue, constipation, and cold intolerance. We're starting to think of that hypothyroidism, and we're looking at those lab values, and they have the elevated TSH level, which would match with your hypothyroidism. But the key finding here is also that they have a history of autoimmune diseases, a autoimmune disease, so that can contribute with Hashimoto's thyroiditis. So this can very well be the cause of their hypothyroidism. So if you see things in a question that speaks on autoimmune disease, start to consider those factors like Hashimoto's, Graves' disease, things of that nature. So in this case, C is your best answer, hypothyroidism due to Hashimoto's thyroiditis. So, as always, I like to kind of give you from a knowledge-based perspective. We'll continue to build on these so that you're able to not only identify and diagnose based off of signs, symptoms, and lab values for hyperthyroidism and hypothyroidism. And then, we'll also move into treatment options as well. But if y'all have questions, let me know. But as always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. But as always, if you're looking to book any of my one-on-one sessions or my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you to make sure, engage what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.